Hello everyone. Today I'm addressing a topic that's important to many older adults, erectile dysfunction or ED. It's a condition that can affect your quality of life, but the good news? There are effective solutions available. First things first, let's talk about medications. Many older adults take medications for underlying conditions like high blood pressure, heart arrhythmias, and Parkinson's disease. While these drugs improve overall health, some may worsen ED symptoms. If you suspect your medication is affecting your sexual health, it's crucial to discuss it with your doctor. Never stop taking your medication without your doctor's approval. They can lower the dosage or suggest an alternative. Now let's discuss testosterone. This hormone plays a key role in male sexual health, including sex drive and maintaining the tissues that supply blood to the penis. As we age, testosterone levels naturally decline, which can reduce sex drive and contribute to ED. It may also lead to increased scarring in the vein network within the penis, impeding blood flow. When it comes to treating ED, doctors often recommend a combination of lifestyle changes and medications. Here are some healthful habits that can help. Eating a balanced diet, engaging in regular physical exercise, losing weight if necessary, quitting smoking, limiting alcohol intake, managing underlying health conditions, and improving sleep habits. A lack of sexual desire can also influence ED. According to a 2020 review, around 82.4% of males aged 80 and above report a lack of sexual desire. Seeking treatment from a sex therapist is one option that could improve sexual desire and reduce ED symptoms. In addition to these lifestyle measures, doctors can prescribe medications for ED. One of the most common treatments is a class of drugs known as phosphodiesterase 5 inhibitors or PDE5 inhibitors. These drugs relax and widen blood vessels, improving blood flow to the penis. Examples include avanafil, Stendra, sildenafil, Viagra, tadalafil, Cialis, and vardenafil, Levitra, Staxin. It's important to note that PDE5 inhibitors are generally safe for older adults, even those with cardiovascular diseases. However, they're not suitable for people taking nitrates for heart conditions. If low testosterone levels are a factor, a doctor may prescribe testosterone replacement therapy, TRT. This involves regularly administering testosterone via injections, gel, or a skin patch. However, TRT won't address common causes of ED like reduced blood flow or nerve damage. To summarize, older adults may experience higher rates of ED due to age-related factors and medical conditions. If you have concerns about ED, it's essential to see your doctor. They can diagnose the cause and recommend appropriate treatments, which may include lifestyle changes, medications, or both. Remember, you're not alone and help is available. Take the first step by having an open conversation with your healthcare provider. Thank you for watching, and take care.